new audiences and innovative practices program in Europe and all over the world. And so today I would like to share with you two of the projects that I've been involved in. One is with the music and dementia workshops, and the other one is the intergenerational practices that I have done in Singapore. And maybe before I begin my presentation, I would actually like to give just a short introduction about myself and how I became to have interest in this topic, especially with the community of the elderly. So this is a picture of me with my maternal and my paternal grandparents. So I have been hanging out, I guess you could say that, with the elderly quite often. You know, my grandparents brought me up, so I followed them to community events. And of course, over the years, I've also grown very close to them. And I even went to sing at hospitals with my maternal grandma. And I think all these activities also help to shape my understanding of the elderly community, not just in Singapore, but also overseas, and how in my capacity as a musician, can I help to improve their well-being. And a very personal story was my paternal grandfather actually was diagnosed with dementia when I was still in high school. And of course, at that time, I have not pursued music professionally, but looking back, you know, what more could I have done to help to improve his condition? So now I would like to share about my experiences at the residential care home for dementia patients in The Hague, Netherlands. So my involvement in this project actually lasted from 2018 till 2020, right before COVID struck. So about dementia, of course, I think everyone's very aware of this sickness or this disease that happens a lot in the elderly, but however, actually it is not a part of the aging process. It can also happen with people aged 65 and below. And it's really affecting a lot of people in the world today. There are 50 million people with dementia, and by 2050 there will be 152 million people who are affected by this disease. And of course, in Singapore, there's also a projected rate of people with dementia at 241,000 people. So what exactly is dementia? So there are also several types of dementia, and one of the most common one is the Alzheimer's disease, which affects up to 70% of the people. So there are behavioral changes like a sudden swing in change of behavior and personality, cognitive decline, memory loss, decreased or poor judgment, unable to express oneself and feeling disoriented. And all these hinders their ability to perform everyday activities on their own. So these persons with dementia actually lack the capacity for well-being and self-awareness, and their identity and capacity for self-growth is then stripped away, and hence is also described as a death that leaves the body behind. And this reality of dementia can really be potentially difficult for others to cope, not just family members around, but also the care staff. And the attempts to communicate with a person with dementia is perceived as a very, very challenging behavior. And thus, you know, this affects the individuals around the persons with dementia, and they'll start to experience a variety of emotions and negative attitudes. And this could lead to the person with dementia feeling very excluded or oppressed, and the personhood undermined. So Tom Kidwood, in his seminal publication called Dementia Reconsidered, The Person Comes First, actually writes about the personhood of the person with dementia at the forefront. So this personhood actually recognizes that the person with dementia transcends their condition, focusing more on the person rather than their illness. So a person with dementia, not a person with dementia. So how can we use music to embrace this uniqueness of the person and to ensure that the person with dementia is acknowledged, valued, and celebrated? So now I would like to share with you the person-centered approach that this music and dementia workshops actually took. So this person-centered approach is to make the person behind the dementia visible again, is to allow these patients to be inside this participative, creative music making process to communicate with us and to actually understand who that person was, you know, a kind of biographical approach. What were they before they actually had this illness? So as you can see here, um, this resident patient from the care home, and this is me. I was leading the whole workshop. So later I'll explain about why, what are these instruments and the process of the whole workshop. So in these workshops, there are actually 8 sessions, which brings together 4 professional musicians, 2 to 4 care staff, 8 residents with dementia, and the total duration is actually only 1 hour session with the residents, a 1 hour preparation with just the musicians, warming up improvisatory, and another 1 hour debrief with the care staff. So how are the patients or how are the residents selected? So most of these residents are actually at varying stages of their dementia. Some are in the mild stages, some are in the advanced stages. And so the care staff actually go into the background of each resident. Do they have an interest in music? Were they a musician before? And if they showed any interest in music, they would be involved in our sessions. And of course, the musicians in this session, in my case, were 2 students from the Conservatory of The Hague, myself and my classmate, and you can see she is here. And it also involves the care staff. This is the care staff, and 2 other professional musicians based in The Hague who have been doing this series for a while. So it's a very, this whole process is a very interconnected relationship, not just between us musicians, but also musicians and the residents and the care staff, and us and the care staff, because the care staff also participate in this process. So there are a lot of interrelational relationships happening just using music as a tool of communication. So how we start the whole series is actually with a framing piece. So as musicians, we play this piece every week. And you see we have the basic melody here on the score with the chord structure. So the musicians actually play different instruments. So I play the flute, and I have my colleague who plays the piano, as you can see here. And then later, there's another colleague who plays the double bass and another colleague who plays the flute. So how do we divide up the parts? What mood do we create in this improvisatory? How many times do we repeat the melody, the first phrase, the second section, and how do we make improvisations, little motifs? How do we call and respond with each other? So these are really concepts of improvisation, creative work that is revisited at every stage in this session. So first we open with the framing piece where the residents come in and sit in a circle, and the musicians will just start to play this piece based on the mood uh, of the space at that time. And then we go into our welcome song. So the text is translated. And so we welcome each of the residents. So we feel like we make them feel that they're part of our circle. And we sing to them, we ask them, how are you today? What instrument would you like to hear play? Is it the flute, the triangle, for them to sing? So of course, throughout the 8 sessions, in the first few weeks, they are very quiet, but slowly they actually start to sing with us the welcome song. They hum with us the framing piece. And this structure of the way we repeat the framing song and welcome song each week also gives them a structure, and to allow them to remember and to even start to recall some of the melodies and the tunes in these songs. And then after that, as the musician's point of view, how do we actually bring them together? How do we curate these sessions together? So I will now move back to this picture. So if you see, there is a table of percussion instruments. So we actually hand out an instrument to each resident. So in this picture, this resident chose a tambourine with the drum in the middle, and my colleague is playing the piano. And I'm also choosing an instrument to accompany the resident. So it's a very intimate kind of improvisation. So we don't know what kind of instrument that the elderly resident will choose. They just pick one, and then we respond and react immediately to what kind of rhythms they play on the instrument. Sometimes also the residents might not want an instrument, they just want to listen to music, so as you know, as the musicians, we actually really don't know what's going to happen. A lot of it is very spontaneous, and hence I have actually summarized what I felt as a musician that I learned from this process of improvisation. So in this picture, you can see this resident is holding a cowbell, and I'm playing the flute, and I'm having a dialogue with him. And there are also, of course, different kinds of residents. For example, this resident is on the wheelchair. Some residents are responsive. They can communicate with us. Some residents really cannot communicate. They are just there. You don't know where they are. But once the music plays, you see that, their expressions on the face change. And I would like to share one expression was this lady, she refused to take any instrument, not even the baton. She just said, play me a piece of music. So we assessed the mood and we thought, okay, maybe we'll go for a more ethereal, more calming piece of music. I took the melody, my colleague who played the bass and another colleague who played the piano, and we just started to improvise. And you could see just the expression from this resident, and her eyes started to swell up. And at that moment, for me, I felt as a musician was so important that, I was not bothered by what was on the score. I couldn't anticipate how she would feel about the music. And, it just really came out from her inside, and that really touched me, and it really touched my other colleagues as well. And in this, I learned also a lot about listening, reacting and trusting, because we don't know what's going to happen. So we need to trust our colleagues, and we also need to trust the residents, and being very authentic. And, we are not being someone else, we're just there in the moment, being in the space, assessing how fast should we go? If this resident is not reacting well, should we move on? Or should we continue to insist that they take an instrument? And of course, in the leadership role, sometimes I'm the one playing the melody, I lead the improvisation. Sometimes I take the back seat. If I feel that the music is getting too loud, I don't want to add another layer of improvisation inside this piece. And we really adapt, to whatever situations. And I think the point about being reflective is also very important, because at our 1-hour debrief session with the care staff also tells us their experience, which is that they have never seen this resident being so expressive in playing the instrument. To them, this resident is just very aggressive in their mood, but the moment they take this instrument, they are transported somewhere else. So as our practice as musicians, how can we actually apply this all these spirit into our own playing, and taking out our own practice from the practice room, from score-based reading into these kind of improvisatory collaborations. So now I would like to move on to the next project that I did, which is the intergenerational practices of a creative music making project, using music to tell the story of the elderly's life. So first, we started this workshop with musical warm-ups, and then the storytelling by the elderly. They actually brought pictures, and they shared their story, how they opened a food stall. In Singapore, we call it char kway teow, so it's fried noodles. And at that time, they lived in Chinatown. It was very busy. How did they meet each other? The husband came from Malaysia, the wife came from Singapore, and how did they build their lives together? So we had 5 children, 5 musicians, an elderly couple, and together actually we came up with a piece of music based on their story. So it started with how the uncle, the husband had his own theme, the wife had her own musical theme, how we weave these themes together, and then how we describe the scene that they lived in Chinatown in Singapore at that time, and how they were even frying noodles, and how they eventually became to settle down and have children and have grandchildren. And then after that, we performed for the children's parents, for the musicians' friends, and also the elderly couple's family members. And now I would like to show you a clip of what happened during the creative music making part. So in this part, we were trying to recreate the scenes in Chinatown. So the uncle was using this washboard to, cut the food. Okay, we have. And you can see how happy they are because this was their first time actually holding a musical instrument or even being part of a musical process. Sorry.
Okay, we ice cream man.
So in also this short clip, you can see that the children are starting to get also a little bit more autonomy and telling her, hey, that sounds like the ice cream man at in Chinatown. So I think all these little, these children have also not been exposed to creative practices. And so for them to be exposed to this at such a young age is also very pertinent in their practice to understand that being a musician is not just going for exams, playing pieces, but is also, taking the skills that you have learned and applying it into a community context such as this. So what are the benefits of intergenerational interactions through music? And it's of course to bring together different generations to collaborate on purposeful activities while supporting and nurturing each other in very meaningful ways. So I felt that, these children actually responded at the end of these sessions that, they have never imagined and they don't have a lot of interaction with elderly in their own time. And in this picture, you can see that the husband, the uncle, he was actually showing the kids the different kinds of games that he played in his time. So everyone was really very, curious, like, what's that game? And also we see that the musicians also taking initiative to be part of this music making process, and which is this term in Dutch called buitenspelen, which means playing outside. So taking the music outside of the conventional practices in a practice room or in a concert halls. So of course, these exposure and stimulation to music also helps the basic needs of satisfaction for the elderly or the purpose, giving them enjoyment, feeling like they had meaning and a say in this end product of the performance, and giving them the autonomy also to make decisions. So for example, which part of their story went in this piece, and they chose the instrument and the part that they wanted to play in the performance, such as cutting the food using the washboard. And also social affirmation that they were actually getting along with children and the young adults, which are the musicians, at the same space, which is not a very common occurrence also to each age group to come together and to understand each other in these practices. So I would like to end my presentation also on what are the challenges and what is the future of these kind of practices of buitenspelen, which is taking the playing outside of the normal context in an institution or even in our normal practices and learning in developing musicians from a young age. What about also including different art forms into this? How could we apply this practice into the Southeast Asian context and also adapt it to COVID and bringing these practices online? So I would like to leave you with these few questions to think about. Perhaps we could discuss at the end of the presentation. And so with this, thank you very much for your attention. And I hope that you have learned more about the work of a music practitioner in this community sense of the elderly. Thank you very much.
Thanks very much, Rachel. Really great questions at the end. And I mean, it's obviously the sort of practices that all of us could be involved in some way, and how to build I guess, an army of practitioners across Southeast Asia. But we can discuss that in about, I guess, half an hour's time after we hear Kat Agras's presentation to us. Just a brief introduction for Kat. So Kat Agras studied originally in the United States, finally in Cornell in the sort of worlds of cognition, but earlier had also been doing and indeed practicing professionally as a cellist. So this combination of music and cognitive studies and eventually interactions with technology bring her into I think a very special place in terms of relevance in the contemporary world. Kat then moved on to the United Kingdom, where she was working at Queen Mary College before coming to the Agency for Science, Technology and Research in Singapore. So it was when she was in A-star that we first got to know of her at Yongsu-to, but actually, and I think this is an incredibly positive thing for SEADOM. In fact, I first got to know of Kat through something that happened in Bangkok at the Princess Kaneyawartana Institute. So sometimes you find out what's going on in your own country by going and interacting with people in other countries. And over time, Kat's come to work more and more with us, and in fact moved to be full-time with us a couple of years ago. And the nice thing about bringing someone like Kat into a conservatory, I think, is unlike many of our other appointments, there's no precedence in our institution, at least. So it gives a certain bit of blue sky in which one can frame what makes sense to the students, what makes sense to the community, and indeed what makes sense for music in the world. It's been great having Kat with us. The students are really enjoying the work at the more immediately practical elements, and also linking in from music out into the university as a whole. But there's so much that Kat could be sharing with us, but I'm glad that she's got her two main projects she wants to share today. And let's get going. So over to Kat Agres. Thank you. Are you there?
Great, thank you very much. Now I'll share my screen. All right. Well, thank you so much for the kind introduction. And also thank you for the SEADOM organizers for inviting me to speak today about my research. So as mentioned, I'm an assistant professor at the Yongsu-to Conservatory of Music, which is a beautiful building shown here. This is where I'm presenting from right now. And although this was mentioned already, I thought I would just give a little bit of background to my research interests. So yes, my background's in music cognition, and I use a variety of different methods, interdisciplinary methods, everything from listening studies and psychological methods to computational modeling and neuroscience, to explore how musical structure influences our perception, cognition, and emotional responses to music. During my PhD, I was particularly interested in learning and memory, but this has expanded greatly in the last few years. I do have a background in cello performance, and I've also been quite interested in music therapy for quite some time. I'm not a certified music therapist, I should say right now, but I have worked with music therapists. Yes, so in the last few years, I've been investigating music-based interventions for health and well-being. So in the talk today, I will give a very brief introduction to music medicine, some of the different music therapies and interventions that can help various patient populations. And then I'll speak about two recent research projects. The first is a survey of music therapists around the world on the changes that have been necessary to their practice to continue practicing music therapy during COVID-19 and the extent to which they've had to embrace technology during this time. The second is what's called a brain-computer interface, BCI device, that uses both music and neurofeedback to promote emotional health in listeners. There we go. So one of the questions that drives a lot of what I think about in my research is how music and music-based technologies and interventions can improve people's lives. There we go. So I'll just go through this very quickly. I thought I would put up some information in case people are interested in talking about this at the end. But very quickly, there are many ways that music-based interventions can help people's cognition and emotional state. So for example, neurologic music therapy can help improve cognitive executive functions, allocating attention, decision-making, things like that. And music can also, actually, one of the main uses for music, at least initially in music therapy, was to have an impact on the emotional state of the listeners. So music can be really effective in decreasing anxiety and depression, and that can be shown even in physiological measures such as heart rate and respiratory rate. Music can also help other domains called transfer effects. So by being involved in music-based interventions, that can actually help with learning new words, verbal recall. And one that is quite interesting to me is it can help aphasic patients, so those who have lost the ability to speak Often this happens as a result of stroke, by means of something called melodic intonation therapy. So melodic intonation therapy, or MIT, helps to sort of rewire the brain so that language is possible again, basically, which is quite amazing, honestly. And music can also be used to enhance memory in Alzheimer's patients, even to help these patients access non-musical autobiographical memories. Briefly, music can also help with motor control and movement. So musical training, of course, can help to improve fine motor skills and gross motor movements. And it can actually be even more effective than conventional physiotherapy in some cases. Music interventions can help walking ability or gait in stroke patients and Parkinson's patients. And for those who have been prescribed physical therapy exercises, music therapy can really help motivate adherence, because sometimes it's difficult to want to do those exercises, but music makes it a lot more enjoyable. And so people recover more quickly when music is involved. Okay, so that's a very quick overview of some of the ways that music can help one's cognition, emotion, and motor control. Now I'll talk about my 2 recent studies. These studies are at the intersection of music, technology, and health. The first is a survey of music therapists around the world, looking at the changes that were necessary due to COVID and the extent to which they use technology and their different views regarding technology. And the second is a brain-computer interface that again uses music and neurofeedback. I'll explain what that means in a moment. It's meant to help those who are using the device, the listeners, mediate their own emotion states. Okay, so let's jump into the first one. Just by means of background, the use of technology in the practice of music therapy has garnered a lot of interest in the recent years. And why is that? Why is technology used in music therapy? Why would one want to use technology? So there are a few different reasons. First of all, it may help to improve patients' well-being. It can help better meet patients' cognitive, emotional, and physical needs, as I just talked about. Technology can also help foster the patient's motivation, purpose, and their sense of identity, for example, through connectivity with others. It can help improve accessibility as well. So, for example, those who have mobility challenges, new digital musical interfaces can allow different ways of interacting with music, new musical instruments, in effect. For example, some can be controlled with eye gaze. So these bring whole new opportunities to a lot of people, accessibility. And it can help with actually conducting music therapy. So it can help music therapists with patient diagnostics and assessment. All right, so now jumping into the paper. So again, we were interested in the changes that have been necessary to keep conducting music therapy during this time. And we were also interested in technology use across 3 major geographical regions around the world. And those were Asia, Oceania, referred to as Asia throughout this talk, Europe, and North America. We actually had 112 music therapists from 21 different countries participate. To our knowledge, this is the first study to look at differences in music therapy practice and views towards technology, looking at so many different countries. We asked about the benefits and limitations of technology, especially with regard to online therapy, and also the therapist's views on what changes may have lasting impacts on the field and what might help in the future. So we did see many different differences across regions in terms of the impact of the pandemic and in terms of differing views towards technology use in music therapy. There were a lot of findings. So I'll just share with you what I think are some of the most important and interesting points. Okay, first of all, 97% of the music therapists in our sample did indicate that their practice of music therapy had changed during COVID. A third of the therapists indicated that music therapy had actually stopped at their institution or that they had to work in a different ward. Several music therapists lost their jobs or were required to work only at one workplace. Obviously, many music therapists often offer their services at multiple venues. So in effect, they lost their job at multiple places. And this was due, of course, to the strict safety measures during lockdown in their country. Some music therapists said that a lot of their patients were no longer able to receive music therapy, and that in some cases had very drastic consequences, especially in end-of-life care. About 3/4 of the music therapists said that there were major changes to the setting in which music therapy was conducted. In-person therapy was often not possible. They had to conduct virtual sessions. When in-person sessions were possible, they had to be conducted in smaller groups, often more individual music therapy, shorter sessions. There were all sorts of restrictions about using instruments, and they were forbidden from singing. So really major changes. And these changes to the setting had, of course, a large impact on the methods and interventions available to music therapists. So many of the therapists had to change from using active to receptive music therapy methods, and it changed the therapeutic relationship between the therapist and the patient. It changed the role of embodied expression and language, the way language was used. So a lot of these therapists were describing that the culture of the music therapy session was changed. That subjective experience was really different. So here's what I think are a particularly striking combination of findings. Here we see, we asked the therapist, during this period of COVID-19, do you believe that there's generally a greater need for music therapy? Okay, and we have this broken down by regions, Europe, North America, Asia, Oceania. We also asked, have you seen fewer patients? So what we found is that, yes, in all regions, music therapists said that there's a greater need for music therapy. This was actually especially pronounced in North America, where all of the music therapists in our sample believe this is true, to a slightly lesser degree in Europe and Asia, but still about 80% or greater of the music therapists do believe there's a greater need for music therapy. But sadly, they've had to see fewer patients due to restrictions and social distancing. 70% of those music therapists who believe that there's a greater need for music therapy right now describe that music therapy is needed to provide social and emotional support and connection in these times of social isolation. As one of the music therapists said so eloquently, music is always about making a connection, and connection is precisely what we tend to lose during this time of isolation and quarantine. So pretty sad and striking finding there. Now we'll talk a little bit about the general attitudes towards technology and its use. So we did ask whether the music therapists use technology broadly defined within their practice, and 85% said they do. And this is in line with an increasing trend, up from 30% back in 2006 to 71% in 2012. So this is part of an increasing trend in technology use. And we also asked them to provide some details about what technologies they've used, what they would like to use in the future, and what technology would need to be able to offer to be worthwhile. The things at the top of the list here were ease of use, accessibility, availability, and affordability. You can consult our forthcoming paper for the details here, but for those who are interested in the various kinds of technologies that these therapists use, here's a brief glimpse here. And it's everything from smart devices and even wearable devices to music software, streaming services, recording technologies, etc. Someone's even used BCI. In the future, many people are interested in BCI and this whole list, really. You can consult our paper for details, though. Now, there's some really interesting regional differences happening in terms of use and use towards technology. In North America and Asia, there's greater technology use compared to Europe, and a greater belief that technology can help with conducting music therapy in the future. North America is also really optimistic about the use of technology being very helpful to help a patient reach his or her goals and outcomes. But at least 2/3 of the music therapists from all regions do believe that technology can help the patient reach their clinical goals more effectively. We also asked some specific questions about COVID-19. So have you needed to embrace new techniques and technologies to conduct music therapy in COVID-19? In this case, again, North America was the most embracing of new technology. In fact, everyone, again, from our sample had needed to embrace some new technology in order to conduct music therapy. They were also very likely to continue using this technology in the future. Europe was the least embracing of new technology and the least likely to continue using technology. And Asia, Oceania, they're largely embracing of technology, but interestingly, they're the most likely to continue using new technology in the future. So one of the biggest technology-related changes for many of the music therapists was having to conduct virtual music therapy sessions. Interestingly, though, this really varied significantly by region. So most of those from North America had to conduct online sessions, over 93%, as opposed to at 3/4 from Asia and fewer than half of those therapists from Europe. Now, in talking about all of these new kinds of technologies that were embraced, we also thought it was very pertinent to ask therapists about the limitations of technology. And there were a lot of findings here. So I'm going to focus on the limitations to conducting online sessions, which I thought were quite interesting and telling. I think that a lot of musicians listening can relate to this as well. The lack of physical contact in therapy sessions had a huge impact on the therapeutic listening attitude of the therapist and the capacity to know the right timing for specific interventions. And also the lack of physical proximity and the lack of nonverbal cues that they could glean from the patient really strains the affective embodied attunement between the therapist and the patient. So there was a real loss of the richness and vitality in that sort of intersubjective experience and process. And this led to a decrease in the engagement and interaction with the patient. So with the findings in mind that compare the use and attitudes across regions of technology, I think it's really interesting to look here at previous training opportunities. So basically, those in Europe have had less technology-related training than those in North America and Asia, a lot less. So it seems that training may be related not only to increased use of technology, which makes sense, but also it leads to more optimistic views of technology. That said, I do need to say that there are, of course, other factors at play here, and there may be some cultural differences at work and differences also in the theoretical approach to music therapy across regions that may be giving rise to this pattern of findings. We also thought it was interesting to look towards the future. So we asked about training in the future, and we saw that all regions would be willing to invest their time in technology-related training. Also, all regions believe that training in conservatories and music therapy programs would lead to greater use of technology. North America, again, was the most optimistic, but all regions very much believe this to be the case. So some takeaway messages were that there were huge impacts on music therapy all around the world. Many of the music therapists in our sample discussed changes to the music therapy setting and how changes to the setting really impacted their methods, interventions, and created a lack of embodied attunement, especially during virtual sessions. So their therapeutic relationship with the patient was strained. Sadly, while there was greater need for music therapy during COVID, unfortunately, they saw fewer patients. In terms of technology use, there's widespread use of technology. Of course, the greatest use and the most positive use were from North America. And interestingly, music therapists from North America and Asia received the most technology-related training. Also, those in North America and to a large extent, those in Asia have embraced new technologies during COVID, and they're very likely to continue using this new technology in the future. All regions would be willing to invest their time in technology-related training in the future, and they believe that this training would foster greater use of technology. Okay, and now a change of gears to my other study, the BCI system for emotion regulation. The idea here is that musical features, such as tempo and mode, can lead to differing neural and physiological responses in the listener. So if we produce basically a computational system that can generate music in real time, we can leverage combinations of musical features in order to enliven and relax listeners in real time. So that can be embedded into a BCI system, a brain computer interface, to flexibly generate music in real time based on the listener's brain state. Okay, what is a BCI? Well, BCI is a computational system that enables a bidirectional communication pathway between the wired brain and the external device, the computer. And by wired brain, I just mean one that's hooked up to an EEG, for example, electroencephalography. It measures the brain's electrical activity in real time. Okay, so this is the pilot study that we conducted. It uses a music generation system to both capture and influence the person's affective state, their emotional state, in real time. So let me explain what I mean by that. Okay, so here's calibration. We have this automatic music generation system. This stimulates the mind of the listener. So this is an EEG camp, by the way. We're not doing anything invasive here, just recording the brain's electrical activity. So the idea is that the music is stimulating the mind of the listener to induce emotion. We then record what's going on in their brain, and we have a model, a calibration model, that maps the musical parameters to their EEG state. So that's an individually calibrated system. And then we have this full system, which has the closed loop interaction. So what's going on here is that we have this automatic music generation happening. So we're inducing emotion in the listener, and then actually what's going on in the brain then influences the music generation system. So basically, this automatic music system is being driven by the brain state of the listener. So in this way, we have two things going on. The music is both influencing the emotion state of the listener, and it's being influenced by the brain state. The brain state is dictating how the generation system will produce music. So hopefully that's clear, but basically this system is a sonification of the brain state or the emotion state of the listener. So just to tell you a little bit about our study. So during this study, there was on every trial a calibration period, a baseline period where we are measuring the EEG, and then the participant has a task. And that task is to either try to make the music sound happier or try to make the music sound more sad. So again, what's going on here is that the participants are trying to gain control of how the music sounds. They're trying to change their brain in order to change the way that the music is sounding, because the music system, the automatic music generation system, is producing music based on what's going on in their brain. So basically what we're trying to test here is the ability of participants to be able to control the music feedback with their brain activity. Just a little bit about the music generation system. It's a rule-based system. We use different parameters such as tempo, rhythm, mode, loudness, and pitch. These are mapped into MIDI, which are then converted into virtual instruments, so they sound a little bit better. And what's going on during the music generation is that we're producing valenced music or emotional music based on Russell's valence arousal model. So this is one way of looking at emotion. This is a two-dimensional model where we have valence here on the x-axis. Negative valence is a low emotional state. Positive valence is something like joyful or happy, positive state. And arousal, physiological arousal, is the activation or the energy level. So we can sort of traverse this space using our music generation system. So I'm going to play an example of something that is high arousal, high valence for you right now. So this quadrant up here. Play a short clip. And now we have something down here, which is lower arousal, low valence. I'm going to stop there, but you can see how the musical features are very different. And I also just want to mention the music generation system is a work in progress. Okay, so moving on to the results. Here are some pictures of brains and their electrical activity. So this is the oscillatory activity of the subjects in our study. And what we found is that there was a significant decrease in beta band activity and an increase in gamma activity over the right hemisphere. Don't worry about what this means. I just want to show that there was an effect across the participants, and really the takeaway here is that they were able to change their brain. The participants in our study could actually change their brain activity in order to change the music feedback. So they figured out how to self-induce emotions to change how the music sounded, the emotional quality of the music. So basically, this system enables emotion self-regulation in listeners. It's classifying their emotional state in real time, but it's also giving listeners a tool by which they can mediate their own emotions by interacting with the system. All right, so that's all for the second study. Just to quickly recap, I talked a little bit about the ways in which music interventions and music technology can promote health and wellness in a variety of contexts. I spoke about a music therapy study and my BCI system. And I want to mention some future directions for this second project. We're further developing this music generation system. We're also pretty soon, we're going to test this BCI system with patients who have been diagnosed with depression and see if it's effective in a clinical setting. And I'm very happy to also say that we have a 4-year grant, myself and other colleagues around Singapore, to combine this music BCI system with other functions to support cognition and motor control. And this will be one big, beautiful, holistic BCI system to help stroke patients. Huge thanks to my collaborators. In the top row, these are the folks involved in the BCI project, and in the bottom row, this is Catherine Foubert. She's a music therapist and also professor in Belgium, and Siddharth is a student here in Singapore. And that's it for me today. Happy to take questions. Thank you so much.
Thank you very much, Kat. Really, there's so much provocation there, and I see we've got a whole pile of questions in the chat, which is great to see as well.
And Bernard, also, everyone in the Zoom today, you can now unmute yourself if you have a question to engage with our panelists. But just make sure you remember to unmute and mute yourself, as you all know about Zoom already. Okay.
Thanks, Joe. So shall we go? First of all, Rachel and Kat, do you have questions for each other as a starting point, having just been listening there?
Do you want to go for Rachel or?
No, it's okay. Perhaps maybe I could just address something quickly. So the work that I did with the dementia patients, so a lot of times people might be wondering, like, is that music therapy? You know, like, what is music therapy? Is what the project that I described is music therapy. So actually, the project I described is not music therapy. It has no clinical outcomes, but the outcomes is more of a social approach and also a creative approach to music making in that context. So I thought I would just like to clarify in case there were some confusions. Yeah. Thank you.
Thanks, Rachel. There was one of the first questions was what sort of what advice would you be giving for people who were not so what works and doesn't work with as useful first training for people with no music therapy background? And I think that question from Punje goes very neatly forward from what you were just talking about. How quickly did you feel you were able to make an intervention that had value? I suppose it'd be simple.
Yeah, so because I was doing this project in the Netherlands, and of course they speak Dutch. So at that time, I do not speak Dutch at all. So you might be wondering, how do I actually verbally communicate with them? So a lot of the times I used a lot of body language, smiling, eye contact, and touch, and I think that really works for them. And what does not work, of course, we need to work very, very closely with the care staff, because they know the needs of each resident. And of course, I think in relation to the first question, how do you deal with the mild and advanced stages of dementia? So they all have very, very different personalities. So also we need to understand the needs of each resident, and sometimes when they're on their own, we had, there was this resident, he just turned around, or he kept turning in circles. But there's nothing we could do. We can't tie him to the spot or give him an instrument or force them to come on, play something on the tambourine. No. So it's just very, very encouraging, very safe space for them. Of course, we also see which instrument suits them based on their mobility. So some of them, they might not be able to move their fingers very well. So we just give them something that they can touch or they can feel. Some of them who are more active in personality, we give them the drum. Some of them who do not want to play any instrument, we just say, okay, we play a piece of music for you. Or sometimes we even give them the option of holding a baton. So they control the music. So it really also depends on each individual. So I would say the recommendation would be to really work with the care staff that is looking after them to see what are their needs. Yeah. Should I also address the other questions, Prof. Langsky? Yeah. So yeah, and at any time also, feel free to unmute your microphone and respond. Yeah. And also about, what kind of difficulties and how do we deal with them? So yes, I've mentioned also a bit just now, we don't force them, never. And we also had experiences of residents who start hallucinating. So for me, I mean, I don't understand Dutch. So at that moment, I didn't know that they were hallucinating, but my colleagues alerted to me, but they say, just move on. I mean, it's not that we don't want to respond to them, but it's that we just really move on with the activity. We show them that, hey, there's something bigger that's happening. So it's really just bringing them into the space and to also adjust our pace. Do we go slower? Do we go faster? Yeah. And what kind of changes
I
happen?
can interject actually there.
Right. Yes.
We're also meant to it's interact with each other,
Yes.
but
Yes.
so this reminds me of one of the findings from the music therapy survey, which was, just how difficult it was to conduct these therapy sessions online, and how do you adjust things like, that your sensitivities as to the timing of when you
Yes.
interject and how you
Mhm.
coordinate. I mean, I didn't even talk about the difficulties of latency issues with trying to perform with somebody, online. So yeah, could you imagine doing what you were doing, but in a virtual setting? Quite difficult, right?
Not easy. Yeah.
Because there's so much of, I'm sure what you experienced was about being there,
Yes.
in the flesh with your, with these individuals, and really having this, as I referred to, this affective embodied, connection with the others.
Yeah. I think that's
Please,
a
please go on. You had some
question.
others.
If they welcomed me at first because I came from a different cultural background and not able to speak Dutch, yeah, they actually really welcomed me. Some of them even, they would touch my face, they would say something, and then whatever I played, or because I was something new. So they were like, "Ooh, like what's that?" Or "Who is she?" And they would always look to me, or they would say, "Oh, moi, moi," like they would say, "Oh, that music is beautiful. Play again." So actually, I did not experience any difficulties because of my culture, and they were very, very embracing towards that. Yeah. I guess I could also lead on to answer one of the questions from Sharon about
Yeah.
what kind of changes happen to the musicians after engaging in this kind of work, or if any. So I think, as I've mentioned earlier, also about being present, being in that moment and adapting to the situation. So I think as a musician myself, not just in the music, for example, if on stage something happens to my score, how am I going to react to it? Or I played in a Debussy trio for flute, viola, and harp, and my violist, one of his strings broke while playing the third movement, like how am I going to respond to it? And in the end, we looked to the harp player. The harp player was like, just continue. It was her exam. And then I just started playing the viola part, you know, at parts that I could. So, you know, this kind of like these kind of aspects that you could actually bring back to your own practice as a performer, or even teaching. And when I'm also teaching a group of children, they are also the same. When I'm giving instrumental lessons, when I'm doing more community workshops. And I think these soft skills are something that we will really bring back and apply to our own practices. Yeah, I hope that answered your question.
Thanks, Rachel. Actually, as Sharon's there, I mean, Sharon, would you like to continue, join into the dialogue, please? It's
Yeah.
great to see you here. Thanks.
Yeah, sure. Hello.
Hi.
Thank you both for your wonderful presentations. Yeah,
Thank you.
thank you for that answer. I also wonder whether, beyond what you have said,
Mhm.
whether it changes your mindset in general about music making and what performance is about.
Mhm. For personally, for myself?
Yeah, for yourself, or if you see in other musicians that you've worked with.
Yeah, so I think for me personally is being in the moment, like being in time, you know, because most of the time we just prepare for something and that is the end point. But that is actually not the end point. The performance that we prepare for is not the end point, is being in the moment itself. And for me, just seeing how a simple tune can you know, instill and evoke so much emotions from a patient who has a disability. For me, it's like, oh, music is actually that simple. Sometimes we overthink too much, you know, like, oh, this phrasing, we do it this way. Oh, would they like it that way? Maybe if I do it this way. But no, you know, sometimes it's just so pure, being immersed in that moment during a performance. So I think that's how it impacted me. Yes.
Right, thank you.
Thank you.
There's a question there for Kat, actually, from Edlin, asking this point about being able to share and to connect up with people who are really interested in knowing more. So one thought was, as we've got people here, I mean, and where there's going to be so many different interests in music, but actually taking Sharon's point there forward as well, some of you, I'm sure, are going to be particularly interested in taking this forward as a field where there could be interactions and so on. So I did want to just, as well as obviously this session being available into the future because it's being recorded and will be on the SEADOM website, just also to link people up, either putting a +1, for example, in the chat area now. If the music and wellbeing area would be something that we could follow up from SEADOM with you on to keep build some sort of momentum in this field, or to write to the SEADOM office, so to pass some of those things through that way. Is it Agustia? Are you there?
Yes, I am.
Well, fantastic, great. Thank you for all your questions.
Oh, you're
Which
welcome.
was, having put those forward, I wondered if you wanted to draw further in any particular direction with Kat or Rachel.
Yeah, I think with Rachel, because she has explained very well. Yeah, and actually she is not a music therapist, but I think she has a lot of interest in working with people with dementia, and I do appreciate for that. Yeah, I just want to know from maybe from Kath about the BCI. I think yeah, it's something new for me. So I just want to ask if because it works in response to the work of brain of the patients, right, Kath?
Exactly.
And yeah, and because also there are many patients actually, if they keep changing, like the brain and also their emotions. So how does the BCI respond to that? Right? Yeah.
Okay. In
Yeah.
non-technical terms, it does. So the BCI system is using this EEG, so electroencephalography, right? The brain's electrical activity. I go like this because there are many little sort of wavy lines that you see in the EEG readout. So the system collects all of this EEG activity, and it uses that. So I mentioned the calibration phase. So it uses a sort of individualized model based on every listener that it creates first, in order to classify how the brain state, well, what the brain state is basically, and how that potentially maps onto emotion states. So it is able to, analyze the brain activity in real time and produce music based on that activity in real time. And that's why we have to use a computational system, because it has to be flexible enough to, produce music based on that brain state right there, second by second. So there's a little bit of lag time. So the system does have to look at the EEG activity and then produce the next, forthcoming measures. But it does respond within a matter of seconds to the changing emotional state of the listener.
And also, does it have also relation to musical genre or musical styles, or it can be anything like something spontaneous, or because I don't know how the algorithm works.
Yeah. Well, right now yes. So there's a lot of flexibility in theory, but if we want different styles, different genres, different instrumentation, we have to build that in. We have to code it into the system. And I'm really interested in exploring that, because music, of course, is very individualized. Preferences are very individual. And I have no doubt that the system would work better for some people than others. So I do hope in the future to have different flavors, so to speak, of the music generation system that can best suit the preferences of the listener. This is an ongoing, research. There's a lot that can be done here. But we were just happy to see that at least in our pilot study, we did see significant effects. People were able to, harness this music generation system and change the sound of the music by changing their brain. So it was a proof of concept, if you will. And now we can really focus on changing and adapting the music generation system, and incorporating all sorts of new musical features, potentially genres.
Yeah,
ongoing.
Thanks, Kat. Yeah, looking forward to it.
Thank you. I've also just given the link to the BCI paper in the chat in case people are interested.
Okay, thank you.
Just 2 points. First of all, I see that Punja's got her hand up, so maybe to a question there, I assume, and then also to draw towards Anatai with the point about how we might, what this might mean for training musicians in this, particularly in this region. I think taking forward that last point as well, how to make it as relevant to here. But Punja first.
Thank you. Sorry, just want to lower my hand first. Thank you for the presentation, Rachel and Agres. Both are wonderful, and thank you for the link to your paper. And I got a few questions for Agres, pretty much about the DCI. The first question would be, I'm very interested in your method in the procedure of your study. First question is, I just wonder, how do you prompt your participants with the EEG attached to their head, and how do you prompt them to think spontaneously to the music? What kind of prompt you use?
What do you mean, how do we prompt them?
I mean, like, how do you communicate with them to do the task?
Okay, so they know roughly what they aim to do, that they have to change. They're trying to change the way the music sounds. I think one of the interesting things here is that we did not tell them to self-induce emotion. We told them that you have to, change something in your mind in order to change the music. In other words, there's a connection between your brain activity and the way that the music is sounding in terms of that two-dimensional arousal valence model. So, if you do something to your brain, you can get the music to sound happier, basically. But we didn't tell them what to do. And so they had to, through some trial and error, figure out that they have to self-induce emotion in some way. And now a lot of people ended up evoking personal memories, happy memories or sad memories for the other task in order to make this happen. But this is where, you know, the really interesting, you know, phenomena is taking place, because people are figuring out, what do I do in my brain? What do I think about? How do I change my mental state so that, you know, and what the music is doing is it's providing this external information, like I said, a sonification of what's going on up here, right? So they have to figure out how to get there. What do I change in my mind to make the music, you know, sound happier or sound more sad? So they were given a prompt as to what they were trying to do on every trial. So it was just a beep or 3 beeps, and that indicated modulate the music so it sounds happier or make the music try to sound more sad. And yeah, based on that, they had to figure something out. And that's why it's really interesting that across the participants, we see some consistency in what happened in the brain.
I see. That's very interesting. So they are free to use any method works for them, just to alter.
Yes, well, within reason, because they are connected to, you know, the EEG cap, so they can't, for example, get up and walk around. They can't do some physical activity. They have to sit there. But yeah, exactly. They have to figure out how to make it happen.
Well, that's interesting. Thank you. And so my second question would be, what is the future of BEZ as like for you as a developer and a researcher? What do you see as the future of this innovation? As for like, I can imagine that it would be very, very useful for diagnosis in terms of therapeutic or in any intervention. What do you think is the future of this method?
Okay, wow, that's a big question. So first of all, yeah, EEG itself has definitely been used quite a lot for diagnosis in hospitals and wards. Specifically for BCI that uses neurofeedback. Are you interested in music-based BCI or BCI in general?
Music-based of BCI. This is pretty much the first time I heard about it.
It's a little easier for me to address.
Yeah.
Well, looking at the music psychology literature, for example, we know that the #1 reported reason people listen to music is to alter or enhance their mood. This is for the general population, not just musicians. And so with that in mind, I think that's why I am interested in using music BCI to change the emotion state of the listener. And, you know, whereas in our pilot study, we used healthy adults, in the future for this 4-year grant, we're actually going to look at clinical patients. So I'm collaborating with someone right now who very kindly has provided access to a fairly large population of patients who have depression. So we'll see if this method is helpful for those who have clinical depression. And then in the future, we will also be testing this technology, like I said, with stroke patients. And it's an exciting project. It's meant to be very holistic. So it's meant to support the emotional well-being, but also cognition and motor activity. So I mean, not to be too cheeky, but I think this kind of holistic, you know, multimodal system is, well, hopefully a good direction to go in for the future.
Well, thank you very much. That is very interesting. Definitely gonna check out your paper.
Thanks. Thank you.
Thanks, Brigitte. Kat, thank you for that. It raises a question, after you've got some of this work working, how easy would it be to transfer to that other people can be utilizing it once you've got the package together? Is it just as simple as a computer and linking up, or more complex than that?
Usability.
Yeah.
Well, yeah, that's a good question. So right now, a lot of BCI projects, including this system, do require some amount of calibration for the user. So that is a component that, because you know, when I'm happy, what goes on in my brain might be similar to what goes on in your brain when you're happy, but it's not exactly the same. And there will be some differences in neural activity. So because of the differences across individuals, also handedness makes a big difference. So I mean, because of the differences across individuals, that calibration stage is pretty important. The good news is that it's not too time consuming. So I think it's feasible to, you know, at least, within maybe 5 minutes, we can calibrate for the user. Now, I think a drawback is that, so we tested our system with not a full electrode cap that has 128 or more electrodes. So often it's quite a lengthy process to get the cap on the listener. We used something that only had many fewer electrodes. It didn't require saline solution or gel. So we are interested in making this sort of easier to use. Yeah, so that it's possible to sort of minimize the time required. And of course, these days there are some interesting off-the-shelf, basically EEG systems. There's the Muse, the Emotive system. There are these different EEG caps that are basically, it's just like a little hat with electrodes on it. So it's much more feasible. So we're sort of investigating multiple directions right now of research grade and also these easy to use off the shelf devices.
Thank you. I mean, I just want to, I see Naron's got his hand up, but just to go back to the Anatai question that was there before about connecting this into institutions and so on, because on the one hand, you've got quite a bit of background technology and so on, some of Kat's stuff there. And on the other hand, obviously, in Rachel's case, she was doing a whole pile of performance around this. How do we centralize these areas of interest into the work? Anatai, are you there?
Can you hear me?
Yes, now, yep.
Okay. Yeah.
Great.
Hello.
Hello, Kat. Hello, Rachel.
Hi.
As you all know each other, I'll leave the three of you to interact for a moment there, and then we'll pass to Narong in a moment. Thanks.
Yes, just a quick question. Actually, I mean, I see that there's a really wonderful work from both of you. Like, I really like Rachel's work. That you really brought out a lot of humanity within musicians and really connected us to the society. And Kat case is a miracle to be understanding how humans actually relating to music in a more kind of scientific way. And I'm just curious that possibly is only for some people as a musicians to be interested in these kind of topics, but to me I think this knowledge is much more important to musicians, and it's not just something that added on, it's a kind of like added value to music afterwards. So I mean, to ask both of you as practitioners, do you see that in the future that these practices or these studies can already be integrated into music studies, that all musician has to be aware of this already from the beginning, so that it's more whole than just kind of like just one aspect of music? I mean, what do you see? I mean, I'm asking also possibly Bernard as well to see what do you think on these matters, because that would be something I really love to know already when I started my music, not at the end or in the middle of my career, something like this. Thank you.
Fantastic question.
Yes, thank you.
Bernard, who should go first here?
Kat, you.
I'm happy to. Yeah. I mean, yeah, I really agree with you, Anatai. And I'm so lucky to be at YST, where there is interest in these other areas, you know, and looking at how the mind and brain and body respond to music. I have, you know, this maybe slightly more scientific perspective, but I'm so lucky that here I'm able to teach a course on music cognition, which gives a broad look at these sort of different main topics. You know, yeah, we talk a little bit about music and health. That whole week is devoted to music therapy and music and health. And actually, yeah, I think that's probably one of the favorite weeks of the musicians that take the class. And also, I'm very lucky this term to be teaching a new module on the psychology of music performance, which gets into performance science and what the findings from cognitive science that can help performers. You know, everything from understanding why we have stage fright, understanding how memory works, how can you better memorize information. There's so many things from psychology and cognitive science that can give us important insight into potentially how to, improve our playing or become better musicians, become calmer. So yeah, I totally agree with you, and I'm very honored and thankful to be here in a place where I can try to impart some of this amazing body of knowledge to students. There will actually also be a course on music and health coming this summer. Yeah.
Thank you.
That's a great news. Thank you.
It raises a great point, which we haven't really covered here today. Of course, that music's good for our own well-being, or doing this sort of activity would be good for ourselves as well. So getting some of that messaging right and early in programs, that one of the reasons you do music is to feel better, because sometimes I see students getting stressed out and feeling worse because of the nature of our engagements with music making. How to give more space in people's own experiences of their music making. So there's all sorts of meta levels which we should take forward into the future. Rachel, any thoughts as a sort of, well, quite recent student on that point from Anatai?
Yeah, I think also adding on, to what you all have already mentioned, also I'm very grateful to be back at YST. So I've been a student at YST and now I'm a teaching assistant. So, I'm really trying to share my practices as an experience when I was a student and now as a teacher. How can I encourage students to really go out of their comfort zone? How can this be, like you said, essential to music making? Of course, performance is very, very important. And I think these skills actually come from performing, and being comfortable at the stage and being out there. And I really feel that this should be a part of music making, and not just in conservatories, but also to start musicians from young, to explore these creative aspects of music. Like I said previously, it's not just notes from the score, but how can you, take out these notes and create something on their own. So, to really start the practices from young would be a good ground to when they get to an institution or a conservatory, that they would already have all these skills to work on in the future.
And it's interesting taking that forward, that obviously in Southeast Asia and across this grouping that Kat defined as Asia and Oceania, there'll be the concept of multiplicities of instruments, of creating your own music as well as playing the music of others. All of these incredibly healthy things that have sometimes become a little bit lost in the last 100 years, let's say, in those other two environments you mentioned. So how we draw in our own practices in this area, as somebody who's now moving from Southeast Asia somewhere else, I like this idea of Asia, Oceania. I can still be part of it. So thank you for that. Narong, you're there with a question or a statement, or is Narong still there?
Yeah.
Great.
So, Kate, it's very, first of all, it's very, very good and interesting, like lecture for both of you, like, and that is fortunate that I'm also like start doing that as well myself. So we went out and do like collecting like a brainwave from kids like age 6 to 9. Pretty much it's the same. So what I'm interested in is like how many different type of brainwave you collect, because now we only collect beta and alpha, and we start like intervention for kids. Basically, we just want to prove that classical music and Thai pop music, they share the some value that, kids can be relaxed when they listen to those type of music. So we want to change the mindset of Thai parent, that it doesn't have to be Mozart all the time. It can be something else.
Yes.
And with our tests, it's really interesting because Chopin Nocturne, for example, and one Thai pop music has the very high alpha wave for kids. Like we tested about 80 something of them, and more than, I think, like 90% react very well to those. So it's sort of like things that we're starting. So in my question is like, I would like to know, like, do you have to go deeper? Like, do you have to go to grammar or theta to collect those stuff and analyze them?
And do we have to go where?
I mean, like, in your research, do you have to go deeper to collect the brainwave to make it work in terms of analyzing, you know, how people feel. Because for us, we just do like alpha and beta, you know, because we do only basic stuff. We don't go to grammar, for example, because that may be, you know, too much information for us to use. So I don't know how the BCI work in that way. And the second question will be like, will the BCI can be like a platform that people can plug in with their research and stuff and share, you know, like information that we collect or you collect and then help each other?
Okay, so yeah, we don't just focus on beta activity, or I think I mentioned gamma as well. So the EEG is classifying all of the different oscillatory bands. Yeah, so theta, beta, alpha, gamma, and I would say we're interested in the next years in our project of trying to isolate or make the connection between how, you know, particular brain states and these bands of oscillatory activity that you're talking about really map onto emotion states, because this is very opaque in the literature. It's difficult to figure out what's going on and how, you know, what music actually changes in the brain and how, what emotion states look like in the brain, basically. So we are interested in things like the asymmetry between the hemispheres in frontal alpha activity. So it's not just looking at how much, you know, beta band activity or alpha activity we have, but the relative amount of activity in one place versus another place in the brain. So yeah, there are a bunch of things that we're going to be investigating in the next few years. So the system does look at all oscillatory bands, to answer that question. And sorry, so your second question was about how we are sharing this knowledge?
Oh, sorry. For example, like in the future, I think it may be a good idea if the BCI can be like a platform that, you know, all people can just plug in and share their information or exchange information. So it shorten the time. Like for me, since I don't know who is doing that outside, right? I start from scratch myself and it took a long time, you know, because now we are going out to school and next month we start to go to senior center to do an activity like Rachel did, you know, like we try to.
Yes. Okay, I understand what you mean now. So access to, well, open access software, and yeah, so I think it's a sharing and accessibility of research sort of issue. Yes, so I suppose I have two answers to that. So first of all, in the link to the paper that I shared, it's freely available online. We also provide a link to the examples of the music, and the PhD student who I was working with, who is now a postdoc, on that website. So basically through the paper, there's a link to a website, and now the music generation code is freely available for use. So so that's good news. We will be developing it further for the grant, and I cannot say yet if it will be possible to make the future code available yet, but surely the idea is to create this package, this holistic BCI system that I was talking about, that may be broadly used. So we don't want this to just become something that you know, sits in a clinical ward that is only used by doctors and therapists in the hospital. We want it to be, you know, available to, you know, to everyone really, and at not such a great expense. So that's definitely my goal. I mean, the point of all of this is to create, you know, music technology that helps people. So in order to reach more people, that is definitely a goal of ours.
Great. Thank you, Kat. So actually, I'm very conscious of time, and that we've actually exceeded the time frame I think that we were aiming with.
No, we're okay, Bernard. We said we were going to go to 12, but we can.
Oh, we're going to 12. Okay, fine, great. No, thank you. But just that point of advocacy into the community from some of the points that were coming on there, and like to change as early as possible the understanding of what values music and arts can be giving into community. And taking Narong's point about us being as connected up as possible to know what's going on and to be sharing this message, particularly across Southeast Asia, I think would be really important in these times. I mean, because as we know, the general message that's out there is, of course, performing arts are really struggling, which of course they are. But the values of this inter-community are at least equally relevant to the performance dimensions. And it's been great to see, certainly in the students over the last 12 months, a realignment of this, a rebalancing, if you like, a recalibration of these different dimensions and of how these synthesize with each other. So it's been really healthy to see that. Have we got? Yeah, please, Kat.
Oh, sorry. It's also, I think it's so important to try to publish in open access venues where possible so that everyone has access to the information and knowledge that we are developing in research. I hope it's okay that I give a link to another paper. This is a recent one. I didn't mention it today, but it's exactly about, well, the title is Music, Computing, and Health. So it's a big collaboration between myself and 14 co-authors. It comes out of a workshop that was held in the Netherlands. Myself and 3 others put on this workshop on music, computing, and health. And this is the paper that's coming out of it, and it's open access. So I just wanted to share it in case it might be helpful for some of you or interesting to some of you. It's been accepted, and it will be so I've shared the official preprint with you, and it will be also open access in the journal Music and Science very soon.
Thank you. Very, very interesting indeed.
Okay. All right. Well,
thank you for all of that. I think in the interest of health and well-being, probably there's a time frame where too much Zoom is not too healthy for us, but it's been great to see so many people tuning in, as well as the wonderful presentations from Rachel and Kat, and the contributions from others who've been able to speak for us. Can I hand back to you Joe, just to take us through some final thoughts?
Just to let people know, if you're interested in referring your department or faculty leadership to SEADOM or getting your institution enrolled as a member in SEADOM, you can find us on the website. You can also interact with us in our Facebook page. This video of this presentation will be available on our YouTube channel, and you can always contact us through our email address as well, and our staff will get back with you quickly. Our next online seminar is planned for April 24th, Traditions in Transition, which will be led by our SEADOM Executive Council member, Professor Vern de la Peña, and Ajahn Anand Nakong from Silpakorn University. So we will have another one of these next month, and the turnout today was fantastic. Thank you everyone for joining, and we really look forward to being able to continue to communicate with each other as we come back to a post-COVID world. So that's it for me, Bern.
Great. Thanks, everybody. Have a wonderful weekend, and look forward to seeing everyone next month. And, you know, we can live and hope that the solutions will be found and we can get back together as soon as possible. Thank you all.
Thank you.
Thank you.
Great.
Bye.